Okay. Good night, guys. Again, my name is Mario Lopez. Good night. We're going to be performing a neurologic exam today. The neurologic exam would consist of the main parts of the mental health status, the sensory and motor function, the cranial nerves, and deep tendon reflexes. Okay, to begin with, we're going to start assessing the cranial nerves. Cranial nerve number one, the olfactory, we're going to be testing with, usually it's not tested in clinical practice in primary care, but what we do is we're going to have the patient close his eyes, close your eyes. We're going to have a type of smell or different types of scents. We're going to obstruct one of the nostrils. Can you please obstruct one of your nostrils? And then can you please smell this? And then we will ask the patient to smell different smells and be asking the patient what the smell was. What did you smell?
Cinnamon.
Okay, cinnamon. So you document cinnamon is right. You usually document, do this type of test in older people. So that's the olfactory, cranial nerve number one. For cranial nerve number two, the optic, what we're going to be doing, just like we did in the other video, is assessing for visual acuity. So visual acuity, we're going to do the Snellen test. We could do with a 20 feet, but in this case, we're going to do with a handheld. So can you, same thing, can you 14 inches away from the face, cover one of your eyes, please? And then you're going to assess, can you please read this line? The line that you could see the best, this line?
95623.
Okay, can you read the one underneath?
No.
Okay, so you got your right eye, so 20/20, you can relax. And then you can go ahead and do the same thing with your eye. Can you please cover your other eye? And then 14 inches away from the face, more or less.
95623.
Okay, can you read the one underneath?
No.
Okay, so your vision is also 20/20. So that's what you can do for the optic, cranial nerve number two. What we're going to be doing to cranial nerve number, cranial nerve number 2, 3, number, that's for the sensory, optic nerve number 2. Then we're also going to assess for pupillary reaction to light. So can you please look at my nose? You're gonna be assessing for pupillary constriction by direct light. Can you please look at my pen? And then can you please look far away, the distance, and then look at my pen again? Okay, and then follow my pen. And then you're gonna look for pupils are equal, reactive to light and accommodation, and the eyes converge. So that is from, also we're going to assess for peripheral view and the visual peripheral view and the with the finger with a wiggle test. Can you please look at my, I'm going to turn this way so we can see the camera. Can you please look at my nose? And then I'm going to be moving my hands behind you, and you're going to tell me whenever you see the fingers wiggling in your peripheral vision, okay? Can you please tell me when you see it?
Yeah.
Okay, again?
No.
Okay, then again?
No.
Okay, so the peripheral visual is intact. That's for optic nerve number 2. And then we're going to go ahead and assess cranial nerve number 3, 4, and 6 at the same time. And these are for the motor movement of the eyes. We're going to be doing the 6 cardinal views of gaze. So I'm gonna move you this way so the camera can see you. So you're not gonna move your head, and you're gonna be following the pen with your eyes only, okay? We're gonna start at the center, we're gonna go to the right, we're gonna go high, then medial, inferior, go back to the middle, center, and then we go to the other, and then we go high, we go low, we go to the center again, and then again the same thing is for convergence. We see that there's no nystagmus in the eyes, and all eyes are able to move in all directions. Then we're gonna assess for the cranial nerve number 5, which is the trigeminal. What we're gonna do is we're gonna do with a sharp object and then with soft object. what you can see is soft, and then this will be the sharp. We're going to be assessing the trigeminal and the different areas of the trigeminal nerve. There will be the forehead, the cheek, and over here. So can you please close your eyes and tell me if you feel a sharp or a dull sensation, okay?
Dull. 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 Sharp. 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 Sharp.
You kind of compare one side to another. That's what you're going to be doing for the sensory part of the trigeminal nerve, the motor part of the trigeminal nerve. You could palpate the jaw and ask the patient to clench the jaw, and you can feel the motor movement of the jaw. Then you're gonna be assessing cranial nerve number 7, the facial. For the facial nerve, can you please puff your cheeks, make a frown, like that. You're gonna be assessing for the symmetry of the movements. For the facial nerve number 7, for cranial nerve number 7, cranial nerve number 8, we're gonna go ahead and that's the auditory. So we're gonna do the whisper test. I'm gonna be saying a word and you have to repeat it. I'm gonna include your ear.
Up.
That's whispering, and then the other side will be the same thing.
Up.
Okay. And as the whispering test was unremarkable, then we can go ahead and do the Ryan and the Weber test. The Weber test is a test for lateralization of sound. What I'm going to do is I'm going to do this tuning fork in your forehead, it could be your forehead or in top of your head. And you can tell me where you hear the sound more, right or left, or both equal. Okay.
Mm-hmm. Both
equal. So that means that there's no lateralization of sound to the right or to the left, and that's to detect any hearing loss or different types of hearing loss. The other test is the Ryan test, and that is to assess the air conduction and bone conduction of sound. Air conduction should always be higher or more than the bone conduction. What we're going to do is this on both sides. First, starting with the right, we're gonna do this tuning forks to the mastoid process behind the ear, and then when you're not able to hear it anymore, behind with the mastoid process, you're gonna tell me, and then I'm gonna pull it right here in front, and you're gonna tell me you still hear it, okay? You're gonna tell me when you stop hearing it.
Okay.
Now I'm putting it in front of your ear. You hear it?
Mm-hmm. Okay.
Okay. So the air conduction is more than bone conduction. Same thing. Tell me when you stop hearing it.
Okay.
And then tell me when you stop hearing it.
Okay.
Okay. So that's air conduction is more than bone conduction. Then we're gonna test cranial nerve number 9 and 10, and we're gonna be can you please cranial nerve number 9 and 10, can you please open your mouth? Say we're gonna check for the uvula, it's midline, and can you please swallow? Can you get some water and get you to swallow, then we'll assess those cranial nerves. Then the cranial nerve that we're gonna go ahead and is spinal accessory number 11, and that is we're gonna move against resistance. So I'm gonna be pushing that way to the right of your jaw. You're gonna push against me, and then again. Can you please show your shoulders? And that is just assessing the strength of the jaw and cranial nerve number 11. Then cranial nerve number 12. We can is the tongue. So can you please open your mouth, stick the tongue out. You can see the tongue is midline. And if I had gloves on, we can test the tongue. You can stick your tongue out, and then immediately we can push against it, and it has to push against my finger to test the strength of the tongue. And that will be for the cranial nerves. That'll be for the cranial nerves. The next aspect of the neurologic exam will be the mental health assessment, mental health status. and that will be before the interview, before you start the assessment. Usually, the patient is awake, alert, and oriented. You ask about history; he's able to remember the history or be coherent with the conversation. That's how you can assess, not exactly asking direct questions regarding that. The next exams are for the cerebellum. So there are different types. I'm gonna be asked the patient to stand up, and the tests are gonna consist of the patient walking. I could have assessed that when he walked in. How is his posture? How is he walking? Is he needing any accessory instruments to walk? So I'm gonna ask the patient to stand up now. You're probably not going to be able to see the different tests, but you can see. Can you please stand right there? It's fine. Can you please walk normal this way? So you're going to assess for the gait, for the symmetry of the walk, and you can stop right there. Now I'm going to ask the patient to walk in tippy toes. Okay, so you can ask for the coordination of the movement. And now can you please walk in your heels? Okay. Same thing, coordination of muscle movement, how he moves, and now tandem walk. Can you please walk heel to like if you're walking in a straight line? Yes, like that. Continue. Check for balance, check for symmetry of movement. Okay, thank you. Now the next test is going to be, the patient is going to be, can you please walk one more step? Right there, you can stay right there. The patient is going to, the Romberg test. He's going to close. Can you please close your eyes? Put your arms forward, facing up like this. Close your eyes, and then you're going to assess for the patient. If he's able to maintain the stance with the balance, you can open your eyes now. It now fall down without not too much movement. After that, you can have a seat now. Now I'm gonna the next step is a test for cerebrosis. What it is that we're gonna ask the patient to close his eyes. We're gonna give him an object, common object, a bobby pin, a pencil, anything that the patient is familiar with, and we're gonna, with his eyes closed, put it in his hands, touch it, and him be able to describe, name it. So can you please close your eyes? You know what that is?
A pen.
A pen. Okay, so yeah, it is a pen. So you could say that is intact. Now the position sense, you can please close your eyes. So what I'm going to do now is you can get a toe or a finger, and you can put the patient, like let's say it's a finger, you can get the toe and put her up, and you can tell the patient how the toe is pointing up or down for the position. So that's what I'm going to do. It's probably not going to be able to show on camera, but is the toe, close your eyes, toe pointing up or down?
Up.
Okay. And you can do that in the lower extremities and bilateral, one or the other, to test for the position sense of the lower extremities. The next step will be the motor system, the motor assessment. So that would consist of the strength and musculature. And the first thing was inspecting, the muscles there's no atrophy, there's no gross abnormality in the main muscle groups. So that's what we're going to do. The first thing is you can assess the strength of the fingers. Can you please open your hands like this? I'm going to try to close. You're going to push against me, okay? Okay, good. And you always do both at the same time or one after the other, the same thing, so you can assess for symmetry, weakness more or greater in one than the other. Now you can put them together like this. Now I'm going to try to open them, and you're going to resist against me, okay? Okay, same thing. Good job. Now we're going to continue assessing the motor system. Now can you please squeeze both of my hands? Assess, but keep squeezing it, and then you can pull a little bit, resisting for the strength. You pull your arms up like that. Can you please push up? Okay, now push up, down. Okay, now put it like this. Okay, you're gonna push against me that way, okay? And then that way. Now flex your elbow, like this. I'm gonna pull, okay? You're not gonna let me pull, okay? And now I'm gonna push, and you're not gonna let me push. You know, like this right here. And I'm not gonna let me push, okay? And now with arms, I'm gonna pull your arm. You're not gonna let me pull your arm, okay? Okay. And now the other side, okay? Now this way. And now I'm gonna pull and don't let me pull. Now I'm gonna push and don't let me push. Okay, that's assessing for flexion, extension, abduction, adduction, every single main muscle group in the upper extremities. You gotta assess for symmetry. That is for the upper extremities. Now that was for the biceps, triceps, and hands. Now we're gonna do the quads, hamstrings, abductors and adductors. So now we're gonna put the patient in a supine position. Okay. We're gonna be assessing for the well. Before that, we're gonna do it at the end. So I'm gonna can you please lift your leg up, and I'm gonna put a little resistance. Okay. Now again, and now I'm gonna try to lift the legs. And you're gonna prevent me from lifting your legs, okay? Okay, that's because the tilting. Okay, now a little bit like that. Now bend both of your knees. Bend both of your knees down. I'm gonna try to push down, and you're not gonna let me push down, okay? Okay, good job. Now I'm gonna try to put your knees apart, and you're not gonna let me pull your knees apart, okay? Okay, and now I'm gonna try to push them together. Now let me push them together. Okay, good job. Now we can also do the hip. Bend your knees, both of your knees. We can try to rotate the hip, but the same thing. I'm gonna try to pull. Okay, same thing, and that way, and this way, that way, the same thing. Up. Now I'm gonna assess your quads. You can see this. Let me see if you can move the camera down. Here we go. Okay. Now, can you please push against me? Okay, and now this one. And now, straighten up your legs like that. The other one. Good. I'm gonna try to push down. Don't let me do it. Okay. Okay. Equal. You do down. Now you're on plantar flexion and extension. Okay. So I'm gonna try to push go like flex your ankle like that. I'm gonna push down against me. Okay. The other one. Same at the same time. Down against me. Okay. And then I want to push down. Okay. That's equal strength on both. Now that we're down here, okay, now sorry. Again. Okay, continue with the video. That's for the motor. That's the motor lower extremities. Also for the lower extremities, can you please put your legs straight up there like that? I'm gonna try to push them together and don't let me. Then I put this apart and don't let me. The same thing for the abductors and adductors. Now sensory. For the sensory system, that'll be for tactile sensation. The upper extremities. Can you please put your arms apart like this? Now the goal is to you can see my face. The goal is to see different type of sensation. It will be sharp against dull, and you can ask the patient to close your eyes. Can you please close your eyes? Mm-hmm. Now I'm going to be touching with soft and sharp objects in both of your arms, and you're going to tell me if it's a sharp or a dull. Okay?
Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Dull.
Okay, and that's how you assess the upper, and you can assess the lower extremities the same way. You're gonna be assessing for the dull sensation.
Dull. Sharp. Dull. Sharp.
You're gonna be assessing for dull and sharp sensation across the upper and lower extremities. with that now, with the in the lower extremities, you could also do the vibration sensation. So what it is, you can get a tonic fork, and then you can do it in the bony prominence of your lower extremities, either right or the leg, right on the toes, and you can ask the patient if he feels vibration or which fit he feels the vibration with the eyes closed. Can you please close your eyes? Put it. What do you feel?
Very.
And which leg or feet?
The toe.
Which foot? Right. Okay. And then that's what you can assess for the vibration on the right of the leg. Now we're gonna go ahead with the reflexes. We're gonna do the biceps, triceps, the tendon reflexes. So for the bicep, you need to have the bicep relaxed. You can stroke the tendon directly. You can put your thumb. So this you can let it rest. Let's do the left one. You can let it rest on you. Relax. You see it? Yeah. And then you can see, and I hit it right there. And you can see the little thumb move, and then you can do the bicep, and then you can do the tricep. You can lean forward a little for me. And then you're gonna try to relax the shoulder. Relax, you can see it. Now you're gonna hit right here on the tendon for the tricep. You should see there. Can you relax? Relax, 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 relax. Relax. Okay. You can hit it right here. You can see the difference on both sides. You gotta do the bicep. On the right and the left. Sometimes you can get it, sometimes you can't. Relax, relax around. Okay, that's for the bicep and the triceps. Then you do the patellar and the Achilles. So you can probably see the patella right there. The feet gotta be diagonal, or if the feet are not diagonal, you can cross your legs and support it. Relax, and you can feel the patella right underneath. There's a little space. Do the other leg too. Relax. That's for the deep tendon reflexes. You can do the Achilles. Probably, let me see if you can see it over here. Right under, you can hit right in the Achilles tendon without a shoe. You hit right under, behind it. You can do the other side. You can do both. Let's compare it. And then while we're there, we can do superficial. And then you can do that's a Babinski, and then you can go from over here to here, and that was a negative Babinski, and then you can do it in both feet. And the way you expect is a plantar flexion. That will be a normal for an adult. And that will be the end of the neurologic assessment. Thank you very much.